My hair is not dirty. It's just wet. I took a shower and didn't dry it. Just so you know. Okay, so we're going to talk about muscle relaxants. Relaxants. I think that's how you say it. Who knows? Okay, so here you go. Take a little screenshot, pause it, do whatever you need to do. I'm already going to say now, I'm going to mispronounce the way that you say these drug names, but that's okay. I don't really care. Okay. For muscle relaxants are typically used for pain from skeletal muscle spasms. It can also be used for people who have chronic diseases and have muscle spasticity because of those chronic diseases. Say they have ALS and they can't open up their hand because their muscles are just like constricting and contracting so tightly. They can help release that and relax their hand. Hence, relaxants. I cannot say that, but you know what I'm talking about. Okay, there are some adverse effects when using these kind of drugs. Patients can get euphoria. They can experience lightheadedness, dizziness, drowsiness, fatigue, muscle weakness. And you really need to monitor these drugs closely if you're using them with another CNS depressant, if the patient is on an opioid, or if the patient is consuming alcohol, which they shouldn't be. But, I mean, that's an ideal world where they shouldn't be. Some people will probably do that. Nursing implications in general for all four of these drugs. You need to assess the patient's drug allergies, their medical history, and their health history. I guess medicine history or health history. It's all the same. Just you need to talk to your patient and find out what they've done and what they've taken. You also need to assess their sleep pattern. You need to assess their anesthesia history. Like, have you ever had anesthesia before? Have you ever had any side effects from it? Did your doctor say you were allergic to the anesthesia? Those are things that we're going to talk about when we get down to this drug. Also, ask your patient about alcohol or drug use. You need to assess their baseline vital signs. And if you're using these drugs for sleep inducing, whatever, you should administer the drugs 30 to 60 minutes before bedtime for the maximum effectiveness of the drug. When your patient has taken these drugs, you're going to evaluate their ability to sleep at night if you're using this drug as a sleep-inducing drug. You're also going to evaluate few adverse effects. Hopefully, they won't experience fatigue, lightheadedness, euphoria, but you're still going to assess these things. You're also going to evaluate decreased muscle spasticity. Say that 5 times fast. And decreased muscle rigidity. Again, you're trying to relax the muscles. That's your goal. You should evaluate if the muscles are relaxed after they've taken this drug. So we've got 4 drugs here. I'm not going to say this correctly, so whatever. I'll just show you, and I'm going to try to say it. Baclofen. Okay, that one's pretty easy. Baclofen, it's also Loracel. That's the brand name. Baclofen is often used in a pump for chronic muscle spasms from chronic spastic muscular conditions. So I guess somebody who has ALS or another disease that would cause their muscles to be constantly constricted, they could have a pump implanted for their body. Cyclobenzaprine, which is also called Flexeril. It's commonly used after a muscle injury, but there is marked sedation. This drug can also be used as needed, so PRN for muscle spasms. So this is something that you're going to need to let your patient know. You're taking a muscle relaxant, and it's going to cause you to be sedated. So that's a little nursing implication. Here we go. Carisoprodol. I can't say these words. The brand name is Soma, which is pretty nice that they make it so easy to say. This one has a high abuse potential. So euphoria, that's one of those adverse effects. This is a high abuse potential drug. And then the last drug we're going to talk about is dantrolene. This is Dantrum. That's the brand name. This is the antidote for a malignant hypothermia. So you remember how we talked about here how you need to ask your patient if they have any history, if they've ever had any surgical procedures where they've been under general anesthesia, or if their doctor has ever said, you had a reaction to the anesthesia and we did this, or they say you're allergic to the anesthesia. This is the antidote for that. It says general anesthesia allergic reaction. That's what malignant hypothermia is. So if you're having general anesthesia for the first time and the patient is starting to have a reaction, normally it's the anesthesiologist would start giving this patient this medicine. So those are the 4. Here again, very short little video. Hopefully you can see everything. pause it, screenshot it, whatever you want to do. I'm not saying these drugs correctly, but this is how you spell them. So yeah, there we go.